Hi guys, and welcome to today's video. Today we have something a little bit different. It's not toenails or calluses. We have a diabetic with a wound, and wounds can heal fine, or they can be the beginning of the end of a toe or a leg in a diabetic. So the takeaway from the video today, besides it's a really nice patient and a kind of an interesting wound, is that if you can't feel your feet, you need to be checking them visually every single day, because something as simple as a blister or an ingrown toenail or a splinter can become infected, and if you're not checking, you don't see it until now the whole foot's infected. So you really have to be checking every day, and this is the result of a patient who just noticed something a few days prior. So it's different. I hope you stick with us. This is part one, and enjoy our video. Okay, so what I'm going to do is I'm going to trim it, and when I trim it so the edges are nice, good bleeding tissue. Yeah. And that's how we get it to heal from the sides in.
Worse. I mean, it looks worse than it is.
Right. Well, maybe. So let's trim all this callus off and see what we got left there.
Okay. I mean, it's not infected, is it?
Doesn't look like it, but let's see what we got underneath here. Hold on. So let's trim some of this real thick stuff off here.
And I can't believe how fast this happened. I mean, I saw you at the beginning of December.
Mm-hmm. Yeah, I mean, with diabetes, that's how they happen. That's why we tell you to check your feet visually every single night.
Right.
And
yeah, and I never even thought about coming in when it was just like cracked skin, because I just put a Band-Aid on it.
Right. Now with diabetics, especially like you where you can't feel what's going on, we definitely want to be preventive with this kind of thing. Now, are you feeling okay? Your blood sugars are doing okay?
Yeah. Okay. But my last A1C last Wednesday was 7, which...
Is that high for you?
Well, it was 6.4 before. Okay. I mean, and before that was 6.8, but it was by my... I kind of negate it because it's by my GP and not by my endocrinologist. So
well, it's the same test.
I know it.
That's how you make yourself feel better about it?
Yes, but I was very disappointed.
Well, infection can raise your blood sugar. And, all right, so here's what I'm seeing. It's not as bad as what I thought. I thought it was this whole area here. But it's not. It's the fissure here, and this is all good, intact skin. So that's the good news. But what we got to do is get that fissure to heal from the base out.
Sure.
And how we do that is by keeping all the callus off. So we're going to be seeing you once a week to come in and trim this.
And, you know, I mean, how come the callus built up so quickly and so hard?
I don't know. That's just the shape of this toe probably is what's causing it, because this is all sitting on the ground instead of this.
I don't know what's going on in your complex, but do you know that like almost all your parking places everywhere are filled? I mean, I've never seen it this filled.
Well, it's the middle of the week.
Really? But you know, I walk by the dentist office.
All right, so what I want to see is how deep does this go? It doesn't look like it's full down to the muscle or anything, but what we got to do is get all this dead stuff off so that it can heal from the base out. and the edges inwards. So because it's like this fissure, you know, just this crack here. I think what I'm going to do is I'm going to have you get a gel, and I'll tell you what it is later. And you can buy it online cheaper than I can get it for you.
Oh.
It's called Medihoney, and have you used it?
You did prescribe it once before for something.
Do you still have it?
Yes.
Okay, so it doesn't really expire.
Oh, okay.
Unless it's 12 years old.
No. It was just, I think, for my other toe, and then it healed, and I never,
okay.
I mean, maybe I used it
So it's the gel
times.
like in the tube?
Yeah.
Okay, so I'm going to have you put that on every day because it does have antibacterial properties in it.
And where?
Just right in the crack that's left.
Like this one right there.
Right there, yep. Okay. I'm just going to put an antibiotic on it today, but go back and check how old that Medihoney is.
Yep.
And that stuff is pretty great. It works really well. And then just put the Medihoney on, and, oh, I didn't measure.
Now I come back March 4th for routine.
Yeah, I want to see you weekly for this.
Okay.
This is 1.2 centimeters. And so we'll have you come back weekly, and that's how we'll get this thing healed. And then just put a little bit of the Medihoney, just like that, just enough to get in that crack.
Okay.
And then cover it with the Band-Aid. And then we'll do this each time you come. And I'm thinking in a couple weeks, probably 3, maybe 4 appointments, we'll get this healed.
Okay.
You know, since the redness is new here, I think we'll do an oral antibiotic at the same time.
Okay.
Okay. Are you allergic to any antibiotics?
Not that I'm aware of.
Okay. And you haven't had any pus coming out of this?
No.
Okay.
I mean, it kind of looks closed up, so I mean, there's...
It's not.
It's not?
Mm-mm. It's a little slit that's open.
Okay.
I mean, it's not a huge round hole, but it's definitely not closed yet. And that's why I'm concerned that this might be a little bit of an infection.
Yeah.
And you also have this up here.
Yeah.
Yeah, which is just a great big crack because there's so much callus. And given that we trimmed this a week ago, do you have one of those flat bottom post-op shoes at home? It's black and it has Velcro that goes over the top.
You know, I may.
Okay, if you do, I want you to go into it now. Just on this left foot. And see if we can get that to heal this up a little bit faster.
And does it take the place of the shoe? Is that what?
Yeah, it's going to immobilize this so it stops moving so much.
Okay.
And that will also help it heal faster. I thought it might be healed by today, but it's not. So I think we're going to do number 1, we're going to do an antibiotic. And number 2, we're going to immobilize the foot. Okay, and just stay in that for as long as you can every day. right, so we are looking at approximately 2 millimeters by 1.5. All right, so I'm just going to put a little antibiotic dressing on that and keep changing it every day, and we'll see you back next week.
Go to the grocery store or
Good.
anything. I just stayed around my house and
Stayed off it for the past week.
stayed off of it.
Good.
Yeah. And then used my boot too.
Yeah. I think those two things made a huge difference because this looks way better. And I'm thinking if you can do it one more week that way, as much as I'm sure it drove you crazy.
Yeah, but this is going to be a bad weekend because it's going to be snowing. I won't go anywhere anyway.
There you go. Yeah. So,
Is there a lot of dead skin?
there's always a lot of dead skin around here for you.
And I'm almost out of that honey stuff, and I keep looking for it online, and it's not that easy to find.
The Medihoney?
Yeah. I'm assuming that first honey is the same.
If it's Manuka honey,
Yeah.
then it probably is. It also is best if it's unpasteurized
Okay.
Manuka honey.
Because they also talk about percentages of this thing that starts with an L. It's a really long name.
Probably an amino acid. So this whole new wound that was there last time, that whole big crack, that's all closed today.
Oh.
So the remaining wound that's down here is pretty small now.
Well, that's the one that I thought was from the tape, too.
This down here?
Yeah.
You know, I'd have to go back and look at the older videos. I'm not sure. But this up here, that crack is closed. So here's what I'm thinking. If we can keep you off your foot for one more week, I'm thinking that this part will also be closed.
Okay.
All right. So good work this week. And, you know, these things just take a long time to heal up. You know, unless I put you in a wheelchair.
Right.
Which I have done with a patient before. Put them in a wheelchair in a transitional care unit for a month to finally get their wounds healed. But this looks really good. So if this one was the one from the tape, the original one is now healed.
Yeah, because the original one was the fissure.
Mm-hmm.
You know, and the other one was just kind of like,
yeah. All right, so let's measure this one. It measures 0.7 by 0.3 centimeters. So if you don't have the Medihoney or Manuka honey or any of that, you can just use some of the antibiotic cream, not the ointment.
Right, right.
Do you have some at home?
Yep, I did bring, I mean, I do have some. I did bring my honey with me, and but I do need to order more.
Okay. I'll just put, for today, I'll just put an antibiotic dressing on it. And we're not using any tape on you, correct?
You know, I haven't been. I just found it was easier just to wrap it with gauze, because sometimes recently when I had my other toe, it just seems like that adhesive had been bothering me.
Okay.
When the skin would get all red.
Yeah. Okay. All right, so a little bit of antibiotic, and then okay. Your name is not going to be in the video. I'm editing that part out.
Sure.
but that's just for me to know. All right, my dear, everything looks really good.
Good.
So the redness is new.
Yeah.
But have you noticed, even just as you've had your foot up for a couple minutes, this has gone down?
Well,
It is kind of warm.
Is it?
Yeah, I think maybe I want to get you on an antibiotic. Just if it wasn't distinctly warmer than the rest of your foot, I would say it's just from irritation, but it is pretty warm. So we'll get you going on an antibiotic for it.
The same one?
We can find a different one.
Oh, no, that's fine.
Okay.
I mean, I didn't have any problems with the other one.
Yeah. So again, this is where the initial issue was, that fissure up at the top here, and that's all closed. So it's this little defect that came with the pulling off of the tape.
And doesn't that one look better, though?
It does. Let's trim it all up to good bleeding tissue, and then we'll see if it's gotten any smaller. Kind of looks about the same, I think. Which is discouraging if you've been making a concerted effort to stay off it more. But, I mean, it's not worse.
Yeah, well, I have been moving around more than I had before.
Okay. Because that week when you really tried to stay off it, it made a huge difference. But the base of it is still kind of what we would say beefy looking. So that's actually really good.
Well, my continuing saga of Medihoney, I got it,
Mm-hmm.
and it was Duroscience, but it also on the box said Integra. And so when I looked it up, Integra is the one that had a recall for contamination.
Oh no.
So, you know, that's what I saw on the website, and then I called, well, I think Walmart is where it came from.
Hang on one second. Okay, so, you know, this looks like it's a little less red than it was when we started, and that may just be because it's been elevated. But other signs of infection would be your blood sugars going wacky, and you said that they were, but it was because you were out of Mounjaro?
Right.
Okay.
I delayed it by days, and I noticed that my blood sugars went up.
Okay, so here's what I'm going to do.
I'm more comfortable taking an antibiotic, to tell you the truth.
Than not?
Than not, because, you know, I am just
Because what I was going to say...
afraid.
Okay. And I don't blame you. What I'm going to do here also is I'm going to outline where the redness is and put today's date on it. And we can get you started on kind of a broad spectrum sort of antibiotic, but if you notice that this redness is going outside the lines, I want you to give me a call.
Sure.
Okay. And then we'll see you back again next week. So that was the end of part 1. What do you think? Do you think we heal the wound? Do you think she loses the toe? Do you think she loses the leg? Not going to tell you. You're going to have to stay tuned for part 2 of this diabetic wound journey.